Hey guys, welcome back to Medical Coding with Blue. Today's episode is Medical Billing and Coding Job Listings Explained. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I have been a medical coder for over 10 years. I created my channel with the hope of sharing all the things that I know with all of you. The tips, the tricks, the stories, the lifestyle about being a medical coder. So if you want more of this content, I hope you'll hit that subscribe button, like, and share this. All right, so let's get started. I am going to be leaving the playlist with the previous videos I've done about medical coding job listings explained down in the description box below. It is so important to really understand the language of these employment listings when you're a brand new medical coder, because this is telling you exactly what the employer is looking for. I get the question so many times, Blue, what are they looking for in the medical billing and coding field? What are the employers really looking for? It is literally right there in front of you. So understanding the language and understanding what they're asking for is really huge. So without further ado, I will go ahead and get into the listings. These came off of Indeed. This is not an ad for Indeed, but I will say this. I'm not leaving the direct link for these jobs because these videos go on in perpetuity, so it may be years from now and people are still watching this video, hopefully. And, so this is just examples, all right? So first one is for a biller for home health. So the home health biller assumes the responsibility of coordination of billing functions in accordance with state, federal, and local regulations. Job qualifications: education, high school diploma, or college is preferred. I will stop here really quick. If you're brand new, preferred is one of those words. Preferred does not mean required. There's a huge difference. And sometimes when people see that, oh, it's, they want college preferred, I can't apply. Apply anyway, okay? When they say preferred, it means, if you have it, great. If not, it's okay. I wanted to be an attorney when I was a kid, so language is really, really big with me, right? So I always look at words, I love reading, and that is one of those things that you really have to look at, okay? So moving right along. It says experience, entry level to 3 years of experience. So right there it tells you they are willing to take on brand new people, and this is for a medical biller position. Skills, computer skills are required. Excellent interpersonal and organizational skill, some knowledge of home health billing, some, all right? And to get this knowledge, you can go to other websites that are going to talk about these things. cms.gov is a wonderful resource because it has the Medicare Learning Network on it. I will leave the link for that down in the description box below. Guys, take advantage of the free resources, all right? Very big. Moving on, typing skills preferred. You got to know how to type. And MS or Microsoft Excel skills are also preferred. The thing is, if you don't have these Microsoft skills like for Office or PowerPoint or Excel or Word, you can. The beautiful thing about YouTube is that they have tons of tutorial videos. So take advantage of that, guys. Watch the tutorial videos so that you can have some awareness of these systems, all right? So, essential functions: manages and maintains responsibility for all insurance, billing, and related payroll duties. Recommends, implements, and directs the agency's billing policies and procedures. Consults and communicates with members of the agency's billing department on a regular basis to coordinate and address appropriate quality program related issues, ensures that all documents are in order and submitted timely according to Medicaid, Medicare, and Plemento standards, serves as a liaison to administrative staff, provides billing, payroll, and staffing feedback as needed. So this person has to be able to communicate. Communication is really huge, guys. All right, and then establishes and monitors and evaluates productivity standards by conducting audits for completion of all appropriate billing and payroll documentation on a regular basis. Enhances professional growth and development through participation in educational programs, staff in-service and workshops. ensures confidentiality of all transactions related to the financial structure of the agency. And then finally, maintains a high standard of compliance in ethical and federal regulation at all times. Okay. Jobs is full-time to part-time. And then it says pay is $12 to $20 per hour. The benefits is dental, health, and paid time off. Medical specialty is home health. Schedule is an 8-hour shift, Monday through Friday. This company This company describes its culture as team-oriented, cooperative, and collaborative. And then it has the company website. And working remotely, it says no. So that is something, if you are just wanting to get started, all right, billing is a really good place to start out at if you cannot get a job as a brand new coder right away. This is going to happen. Brand new coders run into this problem all the time. This is a thing about the industry that I really wish would change, because there are so many really good coders out there who just gave up because they couldn't get a job. And it's very heartbreaking to hear that, because you never know if that one more application or that one more push to try to get a job would have been the difference between not having a job as a medical coder and then having a job as a medical coder. So if you are out there and you're struggling to get your first job, there are many other avenues that you can go, because starting in billing and getting your grounding and sort of starting to know what the industry is like is going to be very helpful for you when you see down the road, maybe 6 months down the road, and you see a job listing opening for medical coding and they want somebody that's a entry level. And then you can say, well, I've been doing billing and I really like to start doing medical coding. That's one way to get in. So I don't want to run out of time because I can go all that way. Let me continue on. So this next one is an entry-level coding specialist. This is how it was when I was putting the title in. It came up under entry-level coding specialist. So again, the wording is going to be different sometimes, because if you put in medical coder into like Indeed, it's only going to give you a fraction. All right. So you have to use other alternative words like entry-level coding specialist, health information specialist, and those kinds of things, because more will start popping up. And these are coding positions. So sometimes, like I said, these job listings are not always written by the people that are actually doing the work, like the coders. They're written by somebody in HR. So their thinking of the wording is going to be a lot different from somebody who's actually a coder that is knowing what they're looking for. And you'll be able to tell the difference, because I've done some of the other videos where I've talked about that, but let's get into the next one. I know, get to the point, Blue. Entry-level coding specialist. Qualifications. Associates required. Now, when you see required for like experience or, because it says ICD-10, 1 year required, go ahead and apply anyway, even if you don't meet that, because sometimes in these jobs, they get so desperate for people. And if they don't have the credentialed coders, because a lot of times coders that are people who have been in the field for a long time and they've been doing coding, but they're not credentialed yet, they may apply. But a person with a credential, they're going to take that person over somebody that's not credentialed, okay? Most times. So that is just something to think of. Don't let that 1 year required stop you if it's a place that you have to physically go. If it's remote coding, guys, we got to talk about that later. But for places that you have to physically go, and right now with the pandemic, everybody's going home. Everybody's being sent home. So don't let that stop you, okay? Go ahead and apply anyway. You need to apply everywhere. All right, so associate required. ICD-10-CM 1 year required. Medical billing 1 year required. Day shift required. CPC, certified professional coder, is required. Certified coding specialist is required. So these are the two that they're saying that they would take. Even if you're a CCA, go ahead and apply anyway. CPT coding 1 year preferred, and medical coding 1 year preferred. So preferred does not mean required. Okay, it's saying that loud and clear. Full job description. We are looking for a coding specialist who can join our revenue cycle team. This employee reviews, determines accuracy of and the application of correct coding conventions to patient charge encounters, procedural and surgical services, as defined through physician documentation, regulatory agencies, and various third-party payers. You will be focused on specific practice at first, but then as your skills grow, so will the workload and opportunities for growth. I'm going to stop right there. So this company is clearly saying that they foster new medical coders, that they want new medical coders in. So just something to be aware of, because it's saying right there. This is considered an entry-level position. And it says it right there. You will work in a somewhat flexible schedule during the traditional work week. Candidates who are enrolled in or have recently completed a coding course are preferred. It says it right there, folks. And when I look everywhere, and I believe this one was from California. So just something to be aware of. It's not all bad out there, guys. You just have to know where to look, okay? And going over these job descriptions, that's why I do it. All right, so benefits is a flexible schedule, medical specialty, cardiology, OBGYN, oncology, pediatrics, primary care, radiology, and surgery. Those are the ones that they focus on. Schedule is a day shift, Monday through Friday. Education associates is required. Again, apply anyway. Experience, ICD-10, 1 year required. CPT, 1 year required. Medical billing, 1 year required. Medical coding, 1 year required. So again, it's going to be who's ever writing this. ICD-10, when you're referring to that, that means the coding, and they say it separately, so. License and certification, CPC required, or the CCS, which is a Certified Coding Specialist, okay? Again, if you're a CCA, go ahead and apply anyway. Or a CCSP, which is a Certified Coding Specialist, physician-based, all right? It is day shift. Working remotely, no, okay? And the next one, Medical Billing Coordinator, entry level. I've been able to find these guys, so there are brand new positions out there. Qualifications, experience, medical billing, 1 year preferred. Preferred, not required. Education, associate, preferred, not required. And it says, we are looking for trustworthy medical billing specialists that can work AR, accounts receivable, denied EOB issues, as well as other responsibilities and duties that are assigned to them, and who is interested in broadening their knowledge and skills and isn't afraid to learn something new. This place is looking for curious people, and you have to be curious. You have to be willing to broaden your horizons, because a lot of times I have seen coders become guilty of this. They get complacent in what they're doing and they want to stick with that. And that's sort of where they have the blinders on, because that's what they know. They want people that are curious, and they're going to say, okay, well, I will try anything. Try anything, guys. So, and it says, if you consider yourself a responsible person and are interested in a fast-paced, deadline-driven work environment, this position may be for you. Responsibilities and duties. Verify that the AR and denied EOB issues received from your assigned collector have been worked according to office policy. Coordinate issues between our collection team in Omega billing, medical billing, and outside parties such as a physician's office and facilities to complete the issue. Keep a master spreadsheet for all the issues that need to be resolved from the outside parties. Reconcile the billing and reporting any errors. Sort and scan the physician billing and EOBs. Send resolutions to the billings collection department once received. Follow up and track to assure that no issues are missed and all required billing has been submitted. Assure the CMS 1500 claim forms are filled out properly. So attention to detail is key, guys. And when you're applying for something like this, Attention to detail needs to be in your resume, okay, because that's what they're looking for. Contact patients to get all the information needed for claim completion. So right here it says contact patients to get all the information. If you are just barely starting out in medical coding and billing, and you've had previous working with the public where you have to do some sort of customer service, whether it was being a cashier or being a hostess or something like that, or being a waitress or a waiter, that's something that you can put on there, that you have people skills, that you have worked with the public before. So again, that is right there saying that you have this skill, and even though you've never talked to patients, think of it in terms of what your skill set is. If you've been in the food service industry and you've been working with the public, that is customer service. So right there, contact with the patients. If you have excellent customer service, if you won any awards for your customer service, you need to have that on your resume, because that's what they're going to be looking for, those kinds of keywords, because you need to make your experience fit their needs. And you having really good customer service skills is going to fit their need for those patients. Qualifications: a certificate in medical billing and coding or an associate's degree. 1 year of experience is required if school was not completed. So if you've gone to school but don't have experience yet, they're willing to accept that. If you haven't completed your school but you have 1 year of experience, they'll accept that too. So again, it's looking at the wording, okay? I get very excited when I see these because I know that this place is willing to hire brand new people. And to me, that's a great thing. Skills: Microsoft Office, Outlook, and Word. Basic computer skills: high energy, professional personality, organization, follow-up skills, able to work in a fast-paced environment, able to handle high volume of workload. If you have been in a busy environment before, if you've worked with like a lot of clients, like maybe, I don't know, working at a clothing store, or even working at a grocery store, and then you have like holiday rushes and things like that, put that in your resume, that you are used to crowds, you are used to high intensity environments. Put that on there, okay? Because believe it or not, those things shine through, all right? You have these skills, you just have to know how to put them into the resume, okay? Are you, and problem solving skills, okay? Job type is full-time. Questions that you have requested Indeed to ask the candidates the following question. So these are some of the questions that they may ask you in the interview. How many years of medical billing and collection experience do you have? What is the highest level of education that you've completed? Are you willing to undergo a background check in accordance with the local law and regulations? They have to do a background check on you guys, because this is private information. And they need to know what your background is. If you've had some sort of something in your past, you need to be very upfront and honest about it, because they're going to find out anyway. Okay. And are you authorized to work in the United States? Benefits is 401k, dental, health insurance, paid time off. Schedules Monday through Friday. Experience medical billing 1 year preferred, not required. And that's it. And then the next one is entry-level medical office billing assistant, okay? Qualifications: high school or equivalent is required. Language is English and that is preferred, but you need to speak English. Work authorization in the U.S. Full job description: as a medical billing office assistant in California, you will be responsible for reviewing medical procedures as documented by the physicians. Medical office billing assistants are the professionals who translate the medical procedures into codes that can be translated by payers, other medical coders, and various medical facilities. Medical office billing assistants handle patient billing, coordinate insurance reimbursement of care providers, and transmit coded patient treatment information to payers and other recipients. Who says that? Me. Responsibilities. Review medical procedures as documented by the physicians. Translate medical procedures into codes. High school diploma is required. Self-directed and able to work independently. Friendly and courteous at all times. Pays attention to detail. Must possess excellent communication and customer service skills. If your speech is not clear or you have a thick accent, I strongly recommend that you do self-improvement actively by watching the dialect videos on YouTube and practicing your speech so that you can make your speech very clear. There's a lot of things that you can do to self-improve. It is about being self-improving because I've seen a lot of people who have really thick accents not be taken seriously because of their thick accent. And if they work on it, then it's much better for them because then everybody can understand. And it is about communication, okay? So, let's see, what else? Strong planning, organizational, and communication skills are essential. Must be able to work well with staff, management, and physicians. So able to work with a lot of personalities, they're saying. Use consistent good judgment and discretion, ability to read, understands, and follows oral and written instruction, and able to take initiative when confronting or solving problems. So they want a self-starter and they want somebody that can take initiative to do the right thing, okay? And doesn't always need to be told what to do, okay? Education requirements, high school diploma or its equivalent. Experience requirements, no experience is necessary. Qualifications, high school diploma. I already read that. It copied itself twice. This is full-time. Pay is $12 to $25 per hour. Benefits, 401k, dental, health, paid time off, retirement plan, vision insurance, Monday through Friday. Language is English. Work authorization in the U.S. And then work remotely temporarily due to COVID-19. Okay. And I have one more, and that's good because I'm out of time. All right, really quickly. Risk adjustment specialist trainee. Risk adjustment specialist trainee is part of the risk adjustment team responsible for researching and resubmitting off multiple systems. ICD-10 and risk adjustment supervisors in all aspects of risk adjustment, including but not limited to the research of medical records, Epic clinical repository, and other databases for additional non-submitted chronic conditions for our senior population in adherence to the general coding compliance standards, and for research and identifying problem areas and solutions for comprehensive, accurate, and submission of all data for all Epic clients. Epic, they have tutorial videos on YouTube. So if you don't have any experience in Epic, that's fine. You can put it on your cover letter that you've been doing your research, and it's going to make you stand out. Do your research, watch those videos. Don't just say that you watched them and then you didn't watch them. You got to watch them, guys. You put that on your cover letter. The risk adjustment specialist works closely with risk adjustment supervisor to support assigned physicians in risk adjustment and auditing activities. Qualifications, high school diploma or a GED. Associate's degree is generally related to the accredited college preferred. Trainee, no experience is required. 6 months of experience or successful completion of the Epic Management Coding Compliance Externship Program. I guess that's someplace you can go to do that. AAPC certification is required within 6 months of hire. So if you are still in school, you can apply for this position, it's saying. All right, but you got to get your certification within 6 months. CPCA, COCA, CPC, or COC or CRC certifications are preferred. They're saying all AAPC credentials, but if you're an AHIMA member, I'm pretty sure they'll take you anyway, okay? It's just sometimes people are more familiar with AAPC than they are with AHIMA. And a specialist is 1 year previous experience with CPT, ICD-10, HCPCS coding required. Practice management, managed care, or web application experience is preferred. That's if you've had experience. Current CPC, COC, or CRC certification is required. So that's it. That is the job listings explained. So I hope this was helpful. I'm talking really fast because I don't want this thing to turn off on me. All right, so I'm going to go ahead and close this one out, but I will be doing more of these where we're talking about the details of these job listings. All right, so if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.